Barrett's esophagus is a condition that's characterized by a change in the cells that are sitting at the bottom of your esophagus. So that's the tube that goes from your mouth to your stomach. And the reason why those cells change is because they're getting repeated damage or exposure from the acid in the stomach. Now, this can happen with gastroesophageal reflux disease, or if you've got high levels of acid production in your stomach, this can occur. And the way that they diagnose it is by doing an endoscopy. They take biopsies and they can check and see what the condition is of the cells down there. Now, Barrett's esophagus is not a cancerous condition, but it's a pre-cancerous condition. It increases your risk of developing esophageal cancers. Now, the way to ensure or reduce the risk of this occurring is to keep the acid production to a minimal in the stomach. And although when we talk about the risks, benefits of medications, yes, you don't want to be on medications like proton pump inhibitors on a long-term basis because there are various risks associated with them. They can mess around with your electrolyte levels, they can increase the risk of C. difficile infections, they can mask the signs of gastric cancers, they increase the risk of osteoporotic fractures, they can mess around with the levels of B12 in your system. So yes, they're not great to stay on long-term, but is the benefit to taking the proton pump inhibitors outweighing the risks? And for patients who have Barrett's esophagus, the risk is, if you don't have adequate control of the acid levels in the stomach, the risk is that you develop an esophageal tumor. And oftentimes these are really quite difficult to treat unless you catch them very early. And if they spread, they can spread to various different areas like liver, for example. And just to kind of cement this, I want to just give you an example. That I had a patient who came out of hospital and we were doing routine monitoring bloods for this person because they had been put onto an anticoagulant medication whilst they were in hospital. So in the process of reviewing or making sure that we did this monitoring, and also there was another medication that we started for secondary prevention, so we just had to do some monitoring. Now it turned out that they had very raised levels of ALP, over 300, referred them for an ultrasound scan, and unfortunately the person had liver cancer. And basically when they did their investigations, it turned out that it was an esophageal tumor that had spread to the liver. The patient had history of Barrett's esophagus and the symptoms had been not very well controlled for quite some time, but they had just been putting up with it. So I think it's really important that when you're having reviews of your medication on an annual basis, if your symptoms are not controlled, this is something that you need to flag up. Even without a review, throughout the year, if your symptoms are not controlled, you need to flag it up. And pharmacists, when you're reviewing patients who are on proton pump inhibitors, particularly for Barrett's esophagus, it is essential for you to check and make sure that the symptoms are controlled. And if they are not, this needs to be investigated further. You cannot afford the risk of having high acid levels when somebody's got Barrett's esophagus. The tumors can be very nasty to treat and it's very difficult to catch it, essentially. And the reviews are one of the greatest opportunities for you to flag up if there's problems going on. I hope this helps somebody, because I feel like even if one person gets treatment or flags up that their symptoms are not controlled and it prevents any problems, then this video will have been worth it. My name is H. I'm a clinical pharmacist and I've been in general practice since 2017, and my whole purpose of getting into general practice was to provide the type of care for patients that I would really hope and pray that my own family members got and people that I care about. So I'm really passionate about what I do, and I really hope that we can engender some of this passion in other pharmacists that are watching these videos, or just encourage patients to seek support if things are not going quite well.